A little different. We're going to put this on YouTube instead of going live this week with the Chiropractic First, hashtag Chiropractic First for the ACA's Chiropractic First month. We're going to talk about cost effectiveness of chiropractic and just the overall cost effectiveness of alternative medicine in general, but primarily obviously with a chiropractic spin on it. There's a lot of concern out there as far as the overall rise of healthcare costs and the overall rise of just managed care and insurance in general, and everybody's looking to live healthier lives, but also to limit some of these costs because the deductibles just keep going up and getting higher. You can see some of these high deductible insurances. So people are looking for ways to save money, stay more healthy so that they don't have to go to as many physicians' appointments and visits. And chiropractic is one of those ways to do that. And we actually have some numbers to back us up. Dr. Peters is going to talk about some of the numbers and some of the research that's out there. A lot of this comes from the workers' compensation world because that's where it's easier to track. Some of that's done under the auspice of pre-authorizations and pre-approval type visits, so it's easier to track some of those numbers. But the truth of the matter is that I think it's like the third most leading cause or reason to go to a physician is back pain. And so whether it's a chiropractor or whether it's a medical doctor, most of this is the medical doctor world research. And so like the third most leading cause outside the common cold, I'm not sure what the second one is back pain. So if you do have those kinds of concerns or those kinds of problems, you're going to see somebody. And honestly, like from a cost effectiveness standpoint, one of the better places to start is with a chiropractor. For one, especially with a lot of the newer chiropractors coming out, they're not going to jump into imaging, and even imaging now is starting to put some regulations on when you can actually get images. Like you actually have to fail conservative care for a certain number of weeks before they even recommend that you get imaging. But you're a lot less likely to get imaging done at most of the newer, what we would call the modern day chiropractors that are out there, because they're going to look at things functionally versus structurally, and so they're going to try to figure things out from more of a functional standpoint, how you move, how the joints are working, how the muscles are working, those kinds of things, and approach it that way. And then if that fails in a 2 or 3 or 4 week window, then maybe the imaging would be recommended. So that's one way that we can limit costs. The other is just the overall appointment costs are lower. We're not significantly lower, like let's not kid ourselves, we're not significantly lower than any other alternative medicines out there, but compared to what you're going to see in like the pharmaceutical costs and some of these other higher end interventional type therapies, we're much lower than those. And Dr. Peters has some numbers with those.
I think that's the number one question we get, whether it's on the phone when people are calling or they come up to their first visit, is how much is it going to cost? And we understand that that's a concern. Everybody has costs, and healthcare costs is going up and up and up, and we want to be able to give you a good answer, but sometimes it's really difficult because we don't know your insurance plan yet, so we haven't verified your benefits. We don't know where else you've been, whether you're an appropriate patient for us. So we do offer a free consultation. If you're interested, we can kind of give you a better idea of A, are you an appropriate patient for our office, and B, if you're going through insurance, what have you met? What is your chiropractic coverage? Our office manager, Joe Lynn, does all of that. And then we can have a better idea of really what is it going to cost. And I think generally, like medical doctors want to write the narrative that, CAM or conservative alternative medicines are so much more expensive. They're not really going to help you. It's just an add-on. And if that's kind of been shown to be false, and there's a lot of interesting research out there. Low back pain initiated with a doctor of chiropractor saves 40% on healthcare costs when compared to that initiated with the medical doctor. Now, I get the argument it's a selection bias. Generally, patients that go to a chiropractor are younger, more active, wealthier, and more educated. So I'd like to spin it the other way, is that birds of a feather flock together. Like, that's pretty good company to be younger, smarter, more active, and I think we encourage that in patients. Like, not only do we attract it, but we also encourage it in our patients that we do have. So those are all things that we try to, like, prevention is a big thing with what we do, and trying to help you live more functional lives. So that's why we're constantly encouraging you to do things to make it healthier, so you don't have to hopefully reach those high deductible plans.
Right.
But like you said, we do cost money. Like, sometimes people get a little surprised, like you think you have full coverage and you don't. So that's why we check your benefits, which they aren't guaranteed over the phone. Our office manager, Jolyn, will say that. But another really interesting study is this is the one, and I heard about this at Palmer Homecoming a couple years ago with Christine Gertz when she did her talk. And I think the underlying message with her talk that I really found was powerful is that we don't have to be, as chiropractors, we don't have to be better at managing neck pain, low back pain. We just have to be as affordable, which we are, if not a little cheaper, and as effective, which we are, if not more effective, because we're a lot safer. And a lot of that research, we're just safer. So if you kind of, this is even, and we're safer, well, then we're probably a better option and a great place to start. As Corey kind of talked about, is conservative care. Even if before you get an MRI, you're going to have to fail conservative care. So the 6 to 8 visits is kind of our standard, like, hey, let's see if we can make some positive changes. And generally at that time, I think patients are kind of like, wow, like I feel a lot better. I'm able to do a lot more. And then they're like, I don't need to go get that MRI. I don't feel like I need to take any more medicine. I just had a guy in here this morning. He's like, I haven't taken any of my pain medicine since Saturday. Now, I didn't tell him that, obviously, but he felt the need. He felt good enough to be like, I don't feel like I need to take that anymore. So that's pretty powerful, and we hear stories like that quite frequently.
Yeah, and that's another good point is, if you could start with somebody that's more conservative minded, like you start with that conservative approach first, and there's no extra add-ons. Like we're not going to upsell you on supplements. Like that's not, it's like we're not going to make a killing on $35 box of supplements. So we're not going to try to, and it's not an upsell with medical facilities. It's just that's kind of what they have for a tool. They have anti-inflammatories, muscle relaxers, and then pain medications, and those cost money. And we don't have those kinds of things that we're going to sell you or have to incorporate into your treatment plan. It's not a sale job. I shouldn't put it that way, but we don't have these other add-ons that we're going to do first. And many of the new chiropractors that are out there aren't doing x-rays right away unless they really think there's some sort of red flag. So the imaging costs are going to be limited immediately. And then just the overall conservative care treatment plan, 3 to 4 weeks, or typically 6 to 8 visits, is going to cost you a lot less than if you went to like a medical facility, got the x-rays, and then started going down like the more aggressive path of the pharmaceuticals, maybe injections and things like that, versus starting super conservative and then going that route if you have to.